Hello, welcome. My name is Terence Banda Shumaya, and today I will be making my final presentation about the United States influenza season. I did submit an interim report a while ago, and today I will summarize the findings of my analysis and provide insights and additional context about the data that I received for this project. So let's get right into it. Yeah, okay. So let's dive straight into our presentation. We start with the motivation. Um, the United States has an influenza season where more people than usual suffer from the flu. Some people, particularly those in the vulnerable populations, develop serious complications and end up in hospitals and clinics, um, and sometimes additional staff to adequately treat these extra patients is critical. So the medical staffing agency provides this temporary staff. So as the motivation depicts, it is important that additional medical staff always has to be available to take care of extra patients. The objective of this project is to determine when to send staff, how many, and to which states. So some states might need more staff and some not. So uh, by the end of our analysis, we will find out which states need more staff and which states do not. The scope of it, of course, is the entire U.S. U.S. Territory. Our project hypothesis is that the population the population of 75 years and above are more likely to die of the influenza infection than the younger population. So that is our project hypothesis. So the next tab, here is a heat map just to provide a general overview of where the hotspots are in the entire US, which states have the highest counts in terms of influenza related deaths. Um, and with this heat map helps us locate exactly those states. This reddish yellowish color, the more reddish and yellowish colors that we have on the individual states, the more casualties that they have. For example, California has the highest number of casualties, and in the subsequent tabs, we will find out what groups um, contribute to this high amount of casualties in the individual in the different states. So this is California. The second is New York, and then here we have Texas. So this provides a general feeling. Upon just taking a glance at this map, you can already know where the problem areas are. On this tab, um, over the years from 2009 to 2017, where we are basing our analysis on, this provides uh, uh, a general view of the number of casualties being experienced per year. And as we can see here, between 2009 and 2017, we've had casualties per year of close to 49,000. So average of actually a bit more than 49,000. So the highest count we have here is 49,708, meaning on average we have like 48,000 casualties per year um, in the United States when it comes to deaths related to influenza infection. The chart here below shows a bar chart in terms of age groups, and from the 75 from 75 years there are more casualties uh, in terms of infections, those that died in terms of infections related to influenza. This next tab shows us a comparative analysis of influenza deaths among age segments of the population. In this chart here, I split the two different segments, age segments of the population, those that are younger than 75 and those that are older than 75. The darker purple color shows the population that is older than 75, and in all the 50 states, we can have the statistics of the population older than 75 and the population younger than 75. And the older than 75 population has more deaths, have more casualties um, relating to the influenza infection than the younger population. And California, as we've seen earlier, tops the chart, next New York, Texas, and so on. So here below is a pie chart that gives us a general overview of which segment of the population is more likely to die of an influenza infection than the other. So here again, we see the 75 years and older. They have registered over the years 325,820 casualties, as opposed to those that are younger than 75 years, close to 90,000. This chart, this is a tree map. This is a tree map representation, tree map presentation, basically just showing the same thing as we saw on this packed bar chart. It's just another form of presenting the same data. The bigger the box, the more casualties the state has experienced in terms of casualties and stuff. So here again, when you hover over the box, you will see the detailed values. The population greater than 75 have casualties more than those less than 75. Now on this next tab here, now we begin to focus more, no more comparative analysis. We start to focus on those that are actually older, because we have now identified the elderly population, our most vulnerable population. So now, from now on, we'll be talking about the population that we need to pay particular attention to, and that is the age group 75 and above. So this chart here shows us the entire population of the vulnerable group, the death counts of that particular group, and the state. So again, we see California has a total population, for example, of about 18,400,000, and with death counts of over 40,000. So this chart here represents all the 50 states, and with its own statistics. Okay, down here, we start streamlining again to see exactly where where the staffing agency really has to focus, to know that these states are states that has priority. We have more elderly people there, and we also have more casualties. So again, California here tops the list. California, second by New York, Florida, Texas, Pennsylvania, Illinois, Ohio, Michigan, North Carolina, and Massachusetts. So these are the top 10 states where the staffing agency needs to pay particular attention in terms of providing more staff to take care of extra patients. So on this next tab, this is just a bubble. It's a packed bubble chart that shows us the top 10 states. Basically just another kind of a presentation, just like this one right here, but shown in another format. The bigger the circle, the more casualties the state has. And here again, California tops the list, second by New York, and so on. The next chart here is it talks about seasonality. It's the season where we have more infections than usual, and this helps now the staffing agency to use the other months in preparing for this particular season. So according to the chart here, um, the months that there are more infections and more death counts are January, February, March, December, and April. So all the other months uh, could be used for some good planning by the staffing agency. So I took 2017 because it is the immediate past, which is good for us to make our forecast going forward. Now the last step here talks about recommendations. Early flu shots campaigns. It is important to carry out timely vaccination campaigns, especially among the vulnerable groups of the population. Campaigns should target the elderly population and encourage mothers to vaccinate their children, especially those less than 5 years old. So again, here is just to make sure that the vulnerable population gets vaccinated, because if that is done, it could considerably drive down the number of infections in the vulnerable groups. And yeah, the next point here is the staffing plan. The staffing agency should adequately plan as per the data at hand to ensure the most vulnerable states have enough staff to handle a potential influx of patients. So, with the correct analysis, with the right data, the staffing agency should make plans to already during those quieter months where you don't have a lot of infections, should already plan as per the data at hand that some of those vulnerable states, those hotspots, should have enough staff to handle an influx of patients that may be coming up and that is probably imminent. So the third is general public sensitization. Public health institutions should regularly inform the public via various media outlets, including social media, on basic infection preventive measures like avoiding public places, washing of hands regularly, etc. So this is just general general information for the public on preventive measures that could be provided by public health institutions. So I think it is important for the public to know that some very simple stuff could be, some very simple measures could be taken to prevent infections. Next steps. In the healthcare industry, if there is one thing we can all agree on, especially when it comes to infectious diseases, is the fact that there is a potential for rapid increase in cases. Influenza is airborne, and as well as it can be contracted via direct contact with a patient, hence making it one of the most rapidly spread diseases. Constantly monitoring certain metrics like increase in cases, especially among the vulnerable population in all the states, healthcare units capacity availability for new admissions, patients to staff ratio as a result of either patients being discharged or new hospitalizations. So this quantitative data will help update the project's analysis and recommendations. It's an ongoing process. So basically here we know we would always have or experience new cases. We will always have hospitals that have more people or less people in terms of allocating staff. So it is important to always keep these data in check so that we can always update our recommendations and make forecasts. So the next step is the frontline health workers and patient surveys. Sometimes mere quantitative data may not capture the entirety of challenges in certain healthcare facilities. Conducting surveys and getting direct emotional responses may help assess certain situations on the ground that necessitate immediate action. It is a fact that sometimes We know the healthcare department is sometimes very stressful. It is surveys are sometimes very, very important to get direct emotional responses from nurses or frontline workers about the conditions of their work, so that maybe uh, um, actions could be taken to ameliorate certain situations. So the next step is KPIs, key performance indicators. Federal, state, and local healthcare institutions should set goals that track vaccinations of the most vulnerable population. This data will help in determining what proportion of the vulnerable population is likely to experience severe complications and casualties. So we know KPIs are a subgroup of metrics very important to track goals that are set to achieve a certain purpose. So if federal, state, and local healthcare institutions set goals on vaccination campaigns, um, that will be very, very helpful in mitigating the infection rates. Data limitations. The raw data received for this research project has some suppressed death counts among certain age groups, mostly from 5 to 44 years, considering that this age segment of the population is not vulnerable, except maybe those with pre existing medical conditions that may develop complications and die of an influenza infection. These suppressed values didn't play any major role in the final analysis. That being said, a positive margin of error of 5% should be considered since all suppressed values were substituted with the zero value. In a nutshell, there are more likely deaths than mentioned. Again, here, um, some of the deaths were not reported, which means uh, basically with all those values from the people, the population between 5 years and 44 years, we didn't have those values to analyze. There probably could be more deaths, though they do not fall in the category of the vulnerable population, but those that have pre-existing conditions could might also fall prey to this infection, and so we didn't have those figures, and that's why I say uh, um, a margin of error of about 5%, because we do not have uh, we do not have people within that category are not likely to die of are not so much likely to die of an infection. Okay, so that is it. I will be providing via email um, the technical details of this presentation. And in case of any questions, feel free to contact me either by phone or by email.